please give Cathie a big, warm welcome.
So, the Lancet series, a new Lancet series on physical activity, was released in July this year. And it's updating a series that the Lancet produced in 2012. And so I'm going to tell you a little bit about the editorial. I don't expect you to be able to read that, but I'm going to tell you a bit about what it says. And so the editorial is called Physical Activity, Time to Take It Seriously and Regularly. And so they give a little bit of history of this area. So back in 1994, physical activity was described as the best buy in public health. And then in 2012, the Lancet produced the first series on physical activity, and they estimated that 5.3 million deaths per year internationally are due to inactivity. And that physical activity is as important a modifiable risk factor for chronic disease as obesity and tobacco. And obviously those things are very important, but I think you'll agree that in the general population and, you know, in the media, there's not as much attention given to the importance of inactivity as opposed to obesity and tobacco. And so now, in 2016, they've updated the evidence and reviewed the current situation. And so they've said that unfortunately physical activity is not improving worldwide, although there are an increasing number of countries that do have a national plan or policy on physical activity. But there's still a long way to go. But there is some positive aspects because we do actually know what to do. So action is possible because there's evidence of effective interventions, but there's been an overall failure to scale or to really roll out the interventions at a large scale. And so also in this issue of the Lancet, there's new research finding that regular activity can actually diminish some of the increased mortality risks associated with prolonged sitting. And so, you know, it's been in the last few years, there's been a lot of talk about the problems of sitting, and that's still the case. But there's growing evidence that if we can be more active in addition to spending time sitting, then that is better for our health. And so this editorial concludes that the world really needs to get serious about physical activity. Partly there's also new research included in this issue about the international economic cost of inactivity, with being $67 billion worldwide through healthcare expenditure and productivity loss due to inactivity. And so that then the editorial really calls for all countries internationally to help really work to achieve a target set by the World Health Organization of a reduction by 10% in physical activity globally by 2025. So yeah, it's quite an inspiring editorial, and obviously you already knew all that, but it's great that there is sort of increasing awareness of these issues internationally and in such an important journal. So in Victoria, as I'm sure you know, there's an increasing proportion of older people in the population, and so this is just the chart showing the proportion of people of different ages. And so I've also pulled out from some physical activity data, so looking currently how physically active older Victorians are. And so this is actually this one's actually nationally, and so looking at how many men and women achieve the target of 150 minutes of physical activity by age. And so we can see that, I'm not sure if this pointer's working. Oh no, you can't see that, okay. So basically from 55 to 64, only around 41% of men and 38% of women nationally achieve that target of 150 minutes a week. And this is any type of physical activity, so organised activities as well as walking for transport or for exercise. And by the time we get to 65 to 74, that's only 37% in men and 39% in women. And in that older age group, 32% in men and 20% in women. And so by state, we know that Victoria Victoria is actually similar to New South Wales, so for all ages. So similar to New South Wales, also similar to Queensland, a little bit better than Queensland. Victoria is actually doing better for the older groups of people. Victoria is actually doing better than the national averages. And so there's actually is a greater proportion of people in those older age groups who are active in Victoria compared to other age groups, which is fantastic. So we do know that there's actually different levels of physical activity nationally by country of birth. And so we know that people who are born in Australia and also in the UK are more active than some people born in some other countries, so particularly Southern Europe and also Southeast Asia. We might just go over these. Okay. So what we looked at in New South Wales, we looked at the proportion of older people who were undertaking different types of organised physical activities. And so because we know that there's lots of benefits in older people of more organised physical activities. And so my research is particularly focused on exercise for preventing falls. And so we know that exercise that challenges balance is particularly effective in preventing falls. And so this was a survey that was done of 5,000 people in New South Wales to look at exactly what proportion of older people are actually regularly undertaking different organised activities. And so we found that, this was a survey that was actually done by the health department, and so it was found that while 80% of older people walked for all purposes, only 12% of people participated in strength or resistance training. 8% of people attended group exercise. 6 to 7% of people did lawn bowls. 6% of people did some balance training. 6% did golf. 3% did dancing and Tai Chi. 2% did tennis. 2% did yoga and 1% did team sports. And so I think it's really important to sort of take a minute to look at those figures at a population level, because I think those of us that are interested in activity ourselves can get a bit of a skewed idea about how active people are, because we're active ourselves and our friends are active, but really at a population level there's an extremely long way to go. And it's also known that older people who are more active are actually more likely to do that in organised activities. And so people who do a moderate or vigorous activity who are older are actually more likely to do that in organised activities than by themselves. So I think there's a really important role for organised activities in this. Really we do have quite a long way to go in terms of really getting people involved in these activities. And this partnership I think is fantastic in you coming together to look at that. And so for a long time now, people have been talking about using evidence to guide both clinical practice and also health promotion practice. And so these are fantastic books on evidence-based medicine and also evidence-based physiotherapy. And so they talk about using evidence to guide practice as needing the importance, as needing the actual evidence. And so from randomised trials and other studies to look at really what is the impact of different interventions. But then in terms of actually getting that to happen, we really need the perspective of the potential participants. So here they're talking about medicine, so they're saying patient preferences and perspectives. But in the community, that's really sort of persons' preferences and perspectives. And so that's why the sorts of things that we just heard about from the listening tour are so important. And then we also need practice-generated knowledge. And really that's that's those of you that are offering programs. That's you in terms of your experience of what's likely to work in promoting programs and getting people along. And I think it's often forgotten. People sort of think, well, okay, we know that exercise is very beneficial, and so we can just expect that people will do it. But we really need to understand the perspective of the person who might be doing it to really look at what's going to encourage them to be involved. And so there we need different study designs to guide, to answer different questions. And so in the falls area, if we want to know, what predicts who's going to fall, then we need cohort studies where we measure a large number of people and follow them over time. So if we want to know what the effect of an intervention is, a falls prevention strategy, for example, then we need randomised controlled trials. But if we want to know what people think and feel about interventions, then we really need qualitative studies. And so qualitative studies have very systematic methods about interviewing people and sort of asking them what they think. And so that's really what we've done in this area, looking at older people's perspectives about physical activity. And so often, sometimes people don't understand the importance of qualitative studies, so they think that, we need cohort studies and we need randomised controlled trials. And that's very true for those questions. So we do need cohort studies and randomised trials to answer those questions about prognosis and about effects of interventions. But if we really want to understand how interventions work and how likely people are to take them up, that's where we really need the qualitative studies. And so I'm going to tell you about some work that we did, and it was a very collaborative work, and so it was led by Marcia Franco, who was a PhD student, also Alison Tong, who's really a world-leading expert in qualitative research. She's worked a lot in the kidney health area, but the methods are really very, very useful here. And then a team of other researchers from different backgrounds as well. And so what we did was we aimed to identify and synthesise the range of barriers and facilitators to physical activity participation in older adults. So we did a systematic literature search of all the different databases that index all the different literature. And so we wanted qualitative studies that explored older people's perceptions and experience about physical activity more broadly, including exercise programs, and looked at perspectives on feasibility and acceptability of interventions. And so we were just looking for studies that included people aged 60 and over. We didn't mind where the people were recruited from, so where they were living. And so we didn't want studies where the data wasn't reported from the study participants. And we weren't interested in more quantitative surveys or questionnaires. So we really wanted those in-depth interviews with older people. And so we use this framework for looking at the quality of the studies as well. And so we identified 11,000 potentially relevant studies, and we looked at 300 full articles, and we found 132 relevant studies. So there was 132 studies, so this was a huge amount of work for the team. And so overall there was actually close to 6,000 older people interviewed in all these different studies. And these studies were undertaken in a number of countries internationally that are shown there. And so we extracted information about how the data was collected, and so these were in interviews, focus groups or surveys with open-ended questions. They used a number of different theoretical frameworks, so within qualitative research there's different sort of theoretical frameworks for extracting information and different ways of analysing that, so we won't get bogged down in the detail of that. And so basically the way we did it was to actually look at the findings of those 132 individual studies and then group the findings into categories and then group the categories into themes. And then to analyse them for similarities and differences. And so it's called a mind map technique. And so this just shows the software that we use. So basically it's just a matter of extracting that information, the key findings and the text from the results from those key studies, those included studies, and then organising them into different themes. So what did we find? So there's a number of key themes that were identified from all these studies, and we're just going to go through them one at a time. So the first one was about social influence, and interestingly, a number of the themes really were identified in the talk before about the listening tour. And so the first was the importance of social influences, so the importance of interacting with peers. And so then I've just got some quotes. And so in qualitative studies, they often include quotes from participants, which really capture the kind of conclusions from the different themes. And so here's someone saying that I made friends and enjoy the food after the class. It's a social thing. We catch up with news from others. It's like a big family. But then the challenge of awkwardness, and that's where, as we were saying before, the importance of supporting people and trying to decrease that awkwardness. And so here this person went along to classes, but they were actually too fast. I was the oldest one, everyone else was younger. So there's a lot of younger people that don't share the same kinds of needs. So it's hard to race an 18-year-old. So I guess that comes down to the design of classes and looking at ways to decrease that social awkwardness. And the importance of encouragement from others is another social factor identified. So my son told me the only thing I should do now is take good care of myself and exercise every day. He bought me a stationary bicycle for me to use at home. And the next theme is about the importance of professional instruction. So we would like a class here at the centre where everyone knows everyone else and feels comfortable, but we don't have a leader, and we need to know what's safe for older people with different health problems. So that's that first theme, really looking at the social aspects. And the next theme looks at physical limitations, so pain and discomfort. So here's someone saying, I used to perform calisthenics every morning, but it resulted in muscle ache. It made me so uncomfortable, so I stopped doing it. Maybe I'm too old to be active. It seems that nothing is suitable for my growing old body. And so we all obviously know that with appropriate guidance, these things can be overcome. Concerns about falling can be an issue. I fell down in my home and broke my right leg. That is the reason my son sent me here. I'm afraid that I might fall again, so I don't want to perform physical activity. If I fall again, it can make my present problem worse. That will be too bad. And then comorbidities is another key aspect of physical limitations. And so that can be a positive if people are feeling supported in that. Well, to me, it also helps to know that other people don't do stuff because of incontinence. So that's the theme of physical limitations. And a big issue for older people, as for any group with participating in physical activity, is competing priorities, so lack of time. My day is busy. I don't have time to be bored. It's hard sometimes to coordinate. That's why I had to stop classes, because it was pick-up time to drive out there and pick up the grandchildren. So I have trouble trying to fit classes around duties. Access difficulties was the next theme that we identified. So environmental barriers. So that can be with home exercise and also obviously with accessing group programs as well. You see the living space here is very limited. There are no places for me to perform physical activity. Most residents, just like me, the only thing we can do is sit the whole day and feel bored. And then financial aspects as well. So she gave me an exercise program. I use it every day. I would like to join a training centre in town, but with my income, I have to look wistfully at that. And so I think that the key thing with each of these is really to understand how there might then be guidance for programs to accommodate these aspects. And I think that the work that Ben Smith and others have done is really helpful in taking that next step and making recommendations for how classes can consider these aspects. And the personal benefits were also identified in being important in whether people would decide to undertake physical activity or not. So benefits can be perceived in terms of strength, balance and flexibility. I thought I'd step in advance and go to the falls program before I begin to fall. That's why I volunteered to take part. As was said before, self-confidence can be very important in terms of perceived benefits of exercise. Here's a quote: "Your self-confidence is reinforced when you come here. The sense of well-being and ability, and you can do things. Sometimes I forget I'm 86 years old." And then the concept of independence can be another important aspect. I was willing to do anything that will enable me to carry on living as I was at the time, independently, being able to do my shopping, looking after myself. That was a huge motivation. So as you can see, that can be very motivating for people. And obviously the health but also mental benefits of exercise and physical activity as well. Here's one saying, "Physical fitness keeps you mentally alert and helps you face the day better." And so the next main theme and the last theme is really about motivation and beliefs. And so here the concept of apathy is important. It's people saying, "I just hate getting started. I just don't feel like it on some days." Laziness. And I'm sure we all struggle with that at times. The perceived inevitability of age-related deterioration. So here's a quote: "When you grow older, your health also becomes worse. It is a natural process and nothing can change it. I'm quite old and I don't think physical activity is worthwhile." So obviously that's a concept that can be addressed with appropriate advertising and encouragement as well. And experiences in the past have also been found to be important with motivation and beliefs. I was always encouraged to be active on the farm and in sports. These experiences seem to have struck a pattern that has continued all these years, and that probably resonates with people that you've met as well. I know in our area in Sydney we have a lot of people involved with the surf club who have been doing it for many years. So then to summarise those, the key themes that we identified from all these studies were the social influences, the physical limitations, the competing priorities, access difficulties, the perceived personal benefits, as well as motivation and beliefs. And so these factors, most of these could either be a barrier or a facilitator. And I think they give really good guidance in terms of really understanding where people are coming from in terms of promoting programs and in terms of how we're interacting with people as well. And so these themes are obviously not unrelated as well. Some of them do influence each other too, so as we showed in the schema that we put in the paper. And so then we did another study also with the same group of people, and here it comes from the marketing area as well, and it's using this thing called a Bestworst scaling experiment. And so here we had a number of people, and it was both online and also a face-to-face survey. And so we had 220 participants, and we asked them to choose the best and worst features of 10 hypothetical exercise programs. And so what they identified as being the key features, the first was cost. And so we said if it was to a program, and we were thinking sort of a supervised session, so we proposed a program that would cost $100, and that was weighted as the worst aspect. So, no one was interested in that. But they were interested, or the features that were the best features were exercise at home, no need to use transport, wanting to see a large improvement in the ability to do daily tasks, with it being free of charge, decreasing the chance of falling to 0%. Unfortunately, that might not actually be realistic, but that's what people wanted from a program. And the less useful aspects, or more of the worst aspects, were to do with travel time and also out-of-pocket costs of $50. And so these things might obviously be not possible to meet with certain organised programs, but it's just worth thinking about in terms of engaging with people and working out for individuals which factors might be more important for them. And, perhaps for some people these factors are so important and they will actually prefer to do something at home rather than coming into a centre. And so I think from that, we can really see aspects that can guide us in promoting and providing programs. And I know Ben's going to talk more about the specifics of that later on. But then I think we all need to be taking a kind of broader advocacy role. And I really think that we all need to be using any interaction with either middle-aged or older people as an opportunity to either prescribe or encourage some type of ongoing exercise participation. And so we need to also be working together to raise awareness of the benefits of exercise, so among patients, health professionals, and also the community. And I think we all need to be advocating for suitable programs to be run by a range of organisations or for existing programs to be supported. And I think we also need to advocate for greater funding of evidence-based programs. So I'm involved with the Australia and New Zealand Falls Prevention Society, and so we've recently put a submission into the Medicare review. So looking at, can we do more for subsidising exercise programs for preventing falls? Because, we have the evidence, we know that these things work, but we just don't have the systems to pay for them. And so then a couple of things I'm just going to tell you about that we've been doing in the advocacy area and also kind of awareness raising. And so the first is a website that's actually hosted, funded and led by the New South Wales Health Department, so the Office of Preventive Health, which is part of that. And my colleagues and I actually now host this website at our institute. And so what it is, it's actually a database of exercise opportunities for older adults. And it also has information about how to become more active as well. And we're actually doing a revamp of the website. We think that maybe it's actually not too user-friendly at the moment. But I think that sort of database and resource can also be really valuable. And so this will work that exercise providers actually register their programs on there, and they log on to this website and they keep their own program up to date. And then the older person or the health professional can actually search the database for exercise opportunities in different geographical areas. And so at the moment there's around 900 programs indexed on that around New South Wales. That's not actually that many for the population of New South Wales and the size of the problem. So remember, I demonstrated that actually only 12% of people participate in group exercise. But, this is the sort of thing that I think we can do collectively to try and address that. And so then the other thing that we've done recently is actually made a short film, which I'm going to show you. But I just need to promote the event that it was for. And so it was actually, this is a national film festival about running. And the Melbourne one hasn't happened yet. It's happened in a number of other states already. And so it's coming up on the 5th of October. And so although it was about running, we thought that was an opportunity to raise awareness about the importance and the benefits of physical activity for older people. And so we actually made a film which we called Active Beyond Running, about encouraging people to participate in physical activity at all ages. And so this was actually a competition, this film festival, and our submission was actually chosen as one of the finalists and is being shown in this film festival nationally, which is very exciting. So yes, encourage you to support them and go along in Melbourne. So it's called Run Nation. And so, we're just going to show it now. So it goes for about 5 minutes, and I'm sure you'll agree there's some very inspiring people involved. Is that volume good?
My name's Terry Campbell. I'm 91 years of age, actually. I've had a great life, really. I've been active all my life. I've been busy, big family, we've got 7 children.
My name is Gail Ann Frost and I'm 64. When I was 18 months old, I had polio. There was an epidemic going through in the 50s.
My name is Dennis McCarran. I'm 70 years young. My outlook on life right at the minute is health. Having gone through a heart situation and my wife's situation with her health, we have a relationship now that's longing and we want to be together forever.
I've always liked to be active, and my whole life has been on my feet. I've got little weights, which are only probably 4 or 5 kilos, they're homemade, but it just gives me a little bit of resistance. And then of course I've got the exercise bike, bit of an antique now, but it works for me. No trying to build yourself up into Mr. Adonis or anything like that.
I've always been brought up to realise and to know that I haven't got a disability. I'm just like another normal person, only I do things a different way.
I make it a point to do between 30 and 40 kilometres a week walking. I actually do Santa Claus for Christmas, and for that you need to be fit. That's another inspiration of I don't want to let people down by not being Santa this year.
I see so many old people who could be so much happier if only they'd get off their tails. It's not hard to do when you don't have to be jumping and running and doing marathons or half marathons and all that. You just got to do that little bit more than you think you're capable of, and it works every time.
I go for my walk, small walk, but now I can do the longer walk. Going down steps, challenge myself to be able to go up a bit of a hill. I'm not using my walking stick so much. My quality of life, it's changed so much. It has. I want to try new things now.
You do the steps, right? You do the walking, and then you're losing the calories. So you think, is that really me? But it is. Over the last 3 years, that's me. An hour a day, whether it's broken up in 3 lots of 20, or an hour, or 40 minutes, or 10 minutes, but get out of the house. Get out of the house.
I feel grotty if I don't do a certain amount of physical exercise. You set yourself a sort of a mental plateau, and if you don't achieve that, you feel you've let yourself down.
You can be a sportsman and you can have heroes, but your own self-esteem, be a hero for yourself and inspire others. You just need the mindset.
I'm not normally a person that would say it, but I sometimes think I like to give myself a good pat on the back, just, for what I've been doing and sticking it all out. Especially the girls that have been helping me. It's been like encouragement, motivation. It's made a big difference as well. Someone will say to you, oh, you can't do this or you can't do that because you're health or because of your disability or because, oh, you're old, you can't do it. And I think that challenge, challenge yourself to do it, to show them you're capable of doing that.
So many people, when they retire, they want to sit down and be a pain in the bloody neck to everybody else, especially their wives, because they think they've retired. You're only retired from work, you haven't retired from life.
So yes, it sounds like you enjoyed that. It was fantastic. And we didn't actually tell them any of those scripts. They actually came up with all those perfect things by themselves, which obviously couldn't have been better if we had have actually scripted them. So yeah, fantastic. And those are all the stars of the film actually went along to the launch of the film festival in Sydney. And I should put some photos in actually. It was very well received, and yeah, lots of people were coming up to them and congratulating them. So yeah, we think that was a good advocacy thing to do in terms of getting the message out there. So I just wanted to acknowledge the funding I received from the NHMRC, as well as all my co-investigators and the participants in all those studies that I talked about, as well as in our film. So yeah, thanks very much.
Well, we won't let Cathie get away too quickly, so how about some questions? It's always the first one's the hardest one to get for some reason. Now, we do have 2 roving microphones, so question over here, Cath.
Is it possible to get access to the film? I'd love to show it to some of my carers.
Yeah, and so because the film festival's still going on, we're not allowed to share the link yet because they want people to come, but they've said that when that film festival finishes, which is I think in early September, there's another screening in Sydney, and yes, after that we will be able to share the link, and yeah, we would love you to show it. Thank you.
Cathy, you mentioned the professional instructors and how older people identified that as a key factor. Did that also include volunteer instructors that may have been appropriately trained?
Mm-hmm. I think it definitely could. And I think certainly a few people have used those models, and yeah, I think that's fantastic and yeah, very appropriate. I mean, the size of the problem is such that we need all hands on deck to try and address it. I mean, I guess just with the ability to be linked in to ask for more expert advice if necessary.
I noticed the drop-off in the physical activity levels nationally for women at the 75 mark, and that it had almost halved from the younger age. Is there any particular causes that you were able to tease out around that age group?
Mm-hmm. And I should just say as well, the data that I hope to show you was actually that drop-off is actually not as extreme in Victoria, which is really encouraging. But I suspect that it's to do with people's sort of physical activity habits maybe not being suitable anymore as they perhaps get older and a bit frailer. So it could be that people who used to walk outdoors or used to catch a bus maybe have had some deterioration physically and are not able to do that anymore. But that's where I think the having different opportunities available and having the kind of mindset and the kind of public awareness that as the fellow said, it's not you haven't retired from life. So you do need to keep being active, but maybe you'll need to do that in different ways, and you might need some assistance to be able to do that. And I guess that's where the encouragement of the health professionals comes in as well.
I'm wondering if you've done research into the benefits of music in exercises. I've been involved for 30 years. I run my own classes, and music, particularly music, relates to a certain age group, such as the rock music we've all grown up with, and Bee Gees, and so I think that gets into the brain as well as working with the body.
So I'm not aware of research in that, but yeah, I think that's definitely right. And in terms of also people feeling comfortable and adding to the enjoyment and the social aspect, because we all know that exercise, it is something that we need to get in the habit of and keep doing. And so if we can find an enjoyable way to do it, then we're more likely to keep doing it, and that's where enjoying the music within the class as well as I guess the benefits of being able to choosing the music to be appropriate to the type of exercise as well.
Yeah, thank you. I've got a question. When you say older people, what age are you calling older people? What, 60 plus, 50 plus?
Yep, that's a very good question. So basically 60 plus. Although, in the national guidelines for older people for physical activity, it really talks about for people who are able to continue with the type of exercise they've always done, then they should be doing that unless there's a reason not to. And so I think that's something we need to really be encouraging sort of at a general level as well, that if people are already, running or cycling or playing a particular sport, then, there's no reason to actually stop that, and that we should be encouraging that as well.
I just wanted to know about the reducing the incidence on chronic diseases, and especially when there is a greater number of the older people having Alzheimer's and dementia very early, and having a national 1-800 number and things like that. How early could exercises be intertwined with diagnosing very early, so that the incidence of prevalence or worsening of the medical condition is really reduced by, perhaps a government incentive, like you were talking about the funding?
Mm-hmm. Yep. No, I think that's totally correct. And, there is also good evidence about physical activity generally in terms of preventing the onset of dementia. I mean, it can't, some of it's not understood. It can't fully prevent it, so we don't also need to be blaming people who get dementia for not being active enough. But yeah, at a population level, there is good evidence. And so I think we are increasingly seeing that in terms of, that's one of the benefits of regular physical activity, is actually preventing dementia. But I think you're right in terms of actually tying that in with diagnosis. And we see that with some other diseases. So, for example, Parkinson's disease, some people do actually become active at that time of diagnosis. And yeah, there's got to be benefits of that. But that's also, I guess, a way of, we need methods for sort of embedding that within health systems and increasing awareness among medical practitioners as well.
Okay, and last question, just in the centre on your right there, Cathy.
I was just curious, when we were talking about looking at physical inactivity or activity, how it was actually measured, and whether you also then incorporate incidental activity as part of that as well?
I mean, it is notoriously difficult to measure, and these national surveys are based on sort of self-report, and it does include incidental activity, but it tends to be, I think, in blocks of 10 minutes or more. Yeah. But all as I understand it, the physical activity literature actually doesn't show an upper limit. So really, the more that you do, the better. And so there is benefits of doing something as opposed to nothing, but there are additional benefits for doing more. And particularly among older people, we know there is additional benefits. So particularly for falls prevention, of balance training, and also strength training in maintaining muscle mass as well.
Big round of applause for Cathy. Fabulous.